There are a couple of clinical scenarios where liquid biopsy could be extremely useful in HCC. One of them is to help us in the surveillance of patients at high risk of liver cancer development, so we can detect them earlier and apply curative therapies. So the current standard for early detection of HCC is ultrasound and alpha-fetoprotein every 6 months. The sensitivity of that to detect HCC is around 63%, so there are a number of patients that are not adequately detected earlier enough to apply curative therapies. So liquid biopsy entails the analysis of tumor byproducts, mostly DNA, RNA, and the actual circulating tumor cells that can be traced, isolated, and analyzed, and there's plenty of data that suggests it could be used as biomarkers for early detection of HCC. There's still not, enough data to say that, but the preliminary data is very promising, so that could help identify the patients earlier. Second area of a lot of interest of these technologies in patients that are candidates to receive systemic therapy. So in the last 2 years, there have been a lot of new drugs that show efficacy in liver cancer and HCC specifically. Now, there are no biomarkers to identify which are the patients that would benefit the most from these therapies. And we don't have access to tissue in liver cancer because most patients are diagnosed with imaging techniques. So if we have some technology that allows us to analyze tumor components, specifically mutations in the DNA that could correlate to response to the therapy, it could be very useful and helpful to select which is the best therapy for the different patients at the different stages.